Hey everybody, it's Dr. Phillips with Texas Chiro Health for our weekly 12 Minutes to Health. I wanted to start by saying thank you for joining us each week. It means a lot that you guys are looking to the research and trusting us to do the research and trusting us enough to ask the questions about your health and what it truly means to get and to stay healthy. It's why I put so much time into picking the right research, the randomized controlled trials, the peer-reviewed literature that's found in the medical journals on the information on how to eat better, how to move more, and how to think better to be a healthier person and live a healthier lifestyle. So I appreciate you tuning in each week. As always, we have our Tuesday night Q&A session inside the office with the doctors where we go over the research but get you the answers to the questions. I know it's a lot of information sometimes to pack into these 12 minutes. So it just gives you a chance to ask the doc some questions and get some more answers for yourself. So we encourage you to join us. We also have some great refreshments for you each Tuesday night. So Tuesday nights at 6 o'clock inside the office. We'd love to see you there so you can get the most out of these talks. When looking at the study we're going to look at today, we have the study was done by Schneider et al. And it's called A Comparison of Spinal Manipulation Methods and Usual Medical Care for Acute and Subacute Low Back Pain. So basically, this is a randomized controlled trial. They took a group of 107 people, split them up. They didn't know that there were other groups, right? They thought they were either getting usual medical care, which was over-the-counter drugs, so your ibuprofen, your Advil, things like that, and then the doctor would tell you, try not to lay around too much, move a little bit more, but that usually low back pain is self-limiting and it should clear up for you. And then on the other side, they had chiropractic care, and they had two types of chiropractic care that they compared all three of these things together. So they had people who were being adjusted by the chiropractor using their hands, a manual thrust manipulation, versus a chiropractor who was using an activator, which is a tool that helps us adjust the spine and different extremities and things like that. But it's just a tool adjusting versus using your hands to adjust. So they compared all three of these things against each other using an oswestry form, which is just a pain questionnaire. So it's really your perception of your pain and how you view your pain, and it's used throughout the medical literature to see how effective care is. So when we look at the methods, I talked a little bit about this already, but there were 107 adults, and of these 107 adults, they had to present with, it said acute or subacute low back pain. So basically what that means is that within the last 12 weeks, they've had an onset of low back pain, and they just focused on low back pain during this study. Like I said, the onset was in the last 12 weeks. They split them up into these three groups, and then they compared all these groups to each other, and they compared them at 4 weeks, they compared them at 3 months, and then they compared them at 6 months. For the groups that were being adjusted, they got adjusted twice a week for those 4 weeks. And for the group that went to the medical doctor and went the usual medical care route, they had 3 visits throughout the 4 weeks where they checked in and they saw better or worse, and they changed their prescription or whatever it was, more Advil, less Advil, just the usual medical route that most of us are used to who haven't seen a chiropractor. So when they checked back in at 4 weeks after they got adjusted 8 times, right, either by hands or by the instrument, the activator, what they found was that when you were adjusted by your hands, the terminologies they used here were that it was significantly better than being adjusted by an activator 4 and significantly better than the usual medical care. And when they look at improvement on the oswestry scales, they're looking for an improvement. A significant improvement is between 30 to 50% better, right? So that's an improvement in score of 30 to 50%. They found that the people being adjusted by a manual thrust manipulation were 94%. 94% of them reached that significantly better status, which is huge. That's a big portion of that group. When they looked at the instrument adjusting group, they found that 69% of them were significantly better. And then when they looked at the usual medical care group, they found that 56% of them had gotten better. So that's almost double on the manual thrust manipulation versus usual medical care. And this isn't what I would call a standalone study. There are hundreds of these studies that they've done, and the manual thrust manipulation studies, they always show a significantly greater improvement over usual medical care. It's done every time. In all of these studies, and we have hundreds of these studies in the office. We encourage you to stop in and grab these studies so you can see this research for yourself. As I tell you, you can't just take my word for this stuff. You've got to dig into it and see what you find. And I think you're going to be amazed, as I was when I first started digging into all this stuff. And when I look at the reason why does the manual thrust always outperform usual medical care? And what I find throughout the research is it's because it's creating motion. That's all there is to it. There is no pill, there's no drug, there's no surgery, there's no injection that is going to create motion for you. So you may get some temporary relief by popping an Advil, but you're not going to see the long-term relief. When they looked at the 3 months and then the 6 months after that, what they noticed is that all three groups did start to return back to where they started. But the manual thrust manipulation it returned half as much as the other two, right? And that's because of motion. I've put up here Hilton's Law. And what Hilton's Law is basically, in a real short layman's term, it's if you don't move it, you lose it, right? So in our spine, we have a lot of joints, right? We have facet joints, we have discs, we have everywhere that each spinal bone meets, the 32 different spinal bones where they line up, they have to have motion in those joints. Because Hilton's Law shows us that the nerve that innervates that joint innervates everything that crosses that joint. So every muscle, tendon, skin, ligament, you name it, that crosses that is innervated by that same nerve. So that's where we start to get pain. We get degeneration and pain when we don't get enough movement in a joint. And that's exactly what the manual thrust supplies for you, is motion back into that joint. It's the same reason that I get adjusted. I try to exercise and move as much as I can, and I don't have back pain. And I haven't had back pain, but I get adjusted regularly to make sure that those joints are moving. Because I can't just pick a certain vertebra in my spine and move just those joints, right? I can create mass motion, but if I'm not getting segmental motion between each segment, I'm going to run into degeneration, which is eventually going to lead to pain and discomfort. Those symptoms are going to pop up, like I always talk about. And then if I'm not eating well, you throw further inflammation onto that, stress, it just adds up. And that's why we don't just address you through an adjustment and keeping things moving. That is one of the most important things we do. But we also look at an entire lifestyle in our office, because you have to have a lifestyle approach to get the full benefit according to the research when it comes to your health. And like I said, there is no medical intervention that we have right now that will create motion while addressing an overall lifestyle. If you go to your medical doctor for back pain, they're going to address that back pain with either NSAIDs, which is the standard of care, or opioids, right? I mean, that's gone through the roof the last decade. I mean, they've even, there was a lawsuit that just settled. They lost $8 billion. They agreed to pay $8 billion back because of their part in the opioid crisis and the overprescription of this. And I mean, it just got out of control, and it never really had a great benefit. It had more of a detriment, which we see now, than it ever had a benefit. And that's why, because it never created motion. It covered up a symptom for a little bit, right? You got some temporary relief, but then you needed more, and then you needed more, and then you had an addiction. And still, we never created motion or addressed the problem of the degeneration that was occurring at that time. So this study is just, like I said, one of hundreds of studies that goes on to show that motion, segmental motion in your spine, is superior when it comes to back pain compared to usual medical care. And it always will be, because it creates that motion. So that's hugely important, and Hilton's Law is a big one. We have Hilton's Law posters and postcards in our office. We really want our patients to grasp the concept of Hilton's Law and just how important motion is to us. So that's a big reason that took place. And right now, I know that as I do these talks, there's some of you out there who have back pain, who have neck pain, who have headaches. I talk to people all the time, and I say, come on into the office. Well, we've created our offer. You guys know about our offer, but we work with local charities, and we have our monthly charities, but we have gotten our cost down to $39 for you, just a $39 $39 donation. And the reason that we bring it that low is to eliminate the excuses. Well, it's going to be expensive. No, it's not. We've knocked that price down, and we're giving all that money away to a community charity, so we get to support our communities as well. But you need to take advantage of that. You come in for the $39 and we'll get your x-rays. We'll do the exam and consultation. We use our proprietary health software that we use that was developed up in Canada. But what it does, the spinal health assessment looks at your whole lifestyle. We see, where did this all start? How did it come about? How are we eating and moving and thinking? And it gives us a health score from 0 to 100. Right? And that health score helps us show you what steps we can start taking and to get you back onto the right path, to follow the research, the truth behind health, the truth behind getting rid of your pain, and get you feeling better, moving better, and just living a healthier lifestyle. So I want you guys to get into the office, give us a call, get set up today. If there's anyone that you know that's struggling with back pain, neck pain, headaches, Chiropractic is great for this. Have them come in on a Tuesday night and just ask the doc some questions. That's free. The refreshments are there, like I told you. But with the $39 donation, there really is no excuse to not start taking care of yourself. So give us a call. Let's get you set up with an appointment. Thank you guys for joining the 12 Minutes to Health. I appreciate it, and I'll see you next week. Thanks.